Thank you, Mr. Doe, for coming in. Really glad you made it in today. I do have some quick questions for you regarding your case history. I just need some more information on different things. Could you tell me just first off how you're feeling today?
Okay, good.
Good.
Uh,
How's the voice?
my voice is fine.
Okay. I see the first thing I was just looking at here is I see you have some acid reflux. How long have you had that reflux for?
About 5 years or so.
Okay. And are you keeping that under control? Is everything going okay with it?
Yeah, my doctor gave me a list of foods to stay away from,
Okay.
and I've been trying to do that.
Okay. Uh, did your, how did they go over a modified diet with you?
Yeah,
So what does that include?
well, I have to stay away from spicy foods, coffee, alcohol,
Mm-hmm.
kind of reduce those.
Okay.
I really cut down on the coffee
Okay.
and the alcohol, but not as much as the spicy foods, tea, and chocolate. I still have those.
Okay. So you said you decreased your coffee intake and your alcohol intake. Was it a significant decrease or?
So for my coffee, I used to drink like probably 4 to 5 cups a day, and now I'm at 2 to 3 cups.
Okay.
What else did you ask me?
Oh, your alcohol intake. How has that significantly decreased as well?
Oh, yeah. It I used to have a beer at every meal as I could,
Okay.
but now I just do it about once a week. I have a beer with dinner.
Okay. And I see you're taking omeprazole. How long have you been taking that?
Since I've been diagnosed with that GERD,
Okay,
so
gotcha. Do you take your daily recommended dose?
yep.
Okay.
And my wife reminds me to do it.
I bet she does.
She does.
How many pillows are you sleeping with at night?
Just one right now.
Just one, so you're laying pretty flat.
Yeah.
Okay. All right, that sounds good. When was your last appointment for your reflux with the GI doctor?
Probably around 6 months ago.
Okay. Sounds good. All right. I also see that you have some hearing loss. Have you been to the audiologist or gotten hearing aids for that?
You know, my doctor wanted to get me to go in, but, you know, it really doesn't bother me that much.
Okay. You okay?
Yeah.
All right. How much stress do you have on a regular basis?
Not that much.
Not that much. You were a preacher before and a social worker. Was that stressful before?
Oh, yeah. Yeah, it was. Busy times.
Yeah.
Yeah, man. I was stressed a lot during those times. Yeah.
But now it's lowered.
Oh, yeah.
A lot more relaxed.
Oh, yeah.
Retirement's treating you well.
Really nice.
All right. Well, where are you having this? It says you feel like you have something stuck in your throat. Where does that happen at?
Probably like right up in here.
Towards the top?
Yeah. If I'm eating, or if I had dinner and a couple hours later, I still feel it.
Is there any pain that's like that?
Occasionally.
How often? Is it painful? Is it all the time or?
No, I'd say like 3 times a week.
Okay. Do you feel like your voice is changed more frequently during certain activities or?
Like if I'm talking to people, I think it gets more hoarse, like how it is now, the way I'm talking to you.
Okay. I see Mucinex and water really, does that really kind of help fix that for you?
Yeah. Oh yeah, it's been helpful.
How often do you take the Mucinex?
Once a week.
All right. Sounds good. Now that you're retired, I just kind of want to know you better and what you do in your free time now.
I go to the restaurant with some of my buddies and we just have coffee 3 times a week. I
Nice.
go there.
Good. So you're being very social.
Yep. Oh yeah, I gotta stay back in the community and help out.
Really? So what are you doing in the community?
Yeah, so we have a county fair
Okay.
and I help out volunteering.
Oh, good. Do you feel that, your voice is affecting you participating in those activities?
No, not too much.
No? Okay. The last question, kind of the big important one. What do you want to get from voice therapy?
Just a healthy voice. I'll think about it if I really need it. So I want to just make sure that my voice is healthy and go from there because I got a lot of appointments. I mean, you saw how.
Oh, yeah, I see it.
So,
All right. Well, that's good to know. Well, we'll see what we can do for you.
All right, Mr. Doe. Now that we've finished some initial questions from your case history, we're going to continue on with the rest of the evaluation. So first, I would like you to sustain the sound interval rate until I tell you to stop.
okay.
All right, thank you. And the next vowel sound I would like you to make is E at a loud, comfortable level until I tell you to stop.
Okay.
Great, thank you. Next, I'm going to have you read some sentences for me. There are 6 sentences, so start here and end there whenever you're ready.
Any, just here to here.
Yep, that's right.
Okay. Blue spot is on the key again. How hard did he hit him? We were away a year ago. We eat eggs every Easter. My mama makes lemon muffins. Peter will keep at the peak.
All right, thank you.
You're welcome, pretty lady.
Next, I just want you to tell me about what you do in your pastime.
Well, I was telling you about the fair earlier, and I'm really excited about it. We get together, we have this huge festival, and there's Ferris wheels and corn dogs and those elephant ears. So good. We have the best milkshakes in the state.
Oh, I bet.
Oh, it's a blast. But it's a lot of hard work and a lot of planning. But it's coming up soon, so I'm really excited. We're taking grandkids.
Wonderful. Well, thank you, Mr. Doe. That sounds like a great thing coming up.
Yeah, it's gonna be a lot of fun. You should come.
Oh, I'll think about it. I will. All right. Now I just have a rating scale to ask you about your loudness and talkativeness. So 1 is being quiet and introspective, and 7, on the other hand, is loud and talkative. So on a scale from 1 to 7, where would you rate your loudness and talkativeness?
pretty talkative guy, and I feel like people can genuinely hear me and understand me, so like a 5 or a 6.
All right. Great. So now I just have a couple more questionnaires just to see how your voice is impacting your overall quality of life.
Okay.
I promise, they're just a couple.
Alright. What do I have to do?
All right, so for this first form, it is a scale from 1 to 5, and just looking at these behaviors, and for each behavior, I would like you to rate 1, never, 2, infrequently, 3, occasionally, 4, frequently, and 5, always.
For all of them?
Yes.
Okay.
Does that make sense?
Got it.
All right.
Alright, there you are, sweetie.
Thank you very much. Next is just another questionnaire about your quality of life. So I want you to circle the response that indicates how frequently you feel the same way about these experiences. So 1 is almost never, 2 sometimes, 3 almost always, and 4 is always.
Okay. Alright, there
Alright.
you go.
Thank you, Mr. Doe. Now I just have one more.
Another thing of questions.
Last
Oh
one.
my gosh.
You're doing a great job so far.
Alright.
All right, this is the last one. So on this paper, you're going to find a list of possible voice-related problems. Please answer all questions based on what your voice has been like over the past 2 weeks. So think back for the past 2 weeks. I want you to rate how your voice has affected your life. There are no right or wrong answers.
Okay.
All right.
Alright, I think I'm done.
All right, thank you, Mr. Doe.
You're very
So
welcome.
we are finished with this part of the evaluation.
So I get to go home?
Almost. We're going to take you to another room,
Alright,
but you're doing a great job so far, so hang in there.
thanks.
Thank you.
Okay, Mr. Doe, so what we're going to do now is use a computer program that's going to help me get some measurements about the vocal quality of your voice and help me to kind of choose what type of therapy would work best for you. And we might take some measurements in connected speech through a reading passage or in sustained sounds where you're holding out sounds. So if at any point you have any questions, just stop and ask, okay?
Okay.
Okay, great. So the first thing that I'm going to have you do is to read this passage in a comfortable, normal voice for you, okay? So I'm going to have you come kind of up near the microphone a little bit. I want your mouth to be pretty close, about 3 centimeters away. Perfect. And take a big, deep breath in with your belly like we were talking about before you start, okay? So go ahead.
When the sunlight strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. These take the shape of a long round arch with its path high above and its two ends apparently beyond the horizon. There is, according to legend, a boiling pot of gold at one end. People look, but no one ever finds it. When a man looks for something beyond his reach, his friends say he is looking for the pot of gold at the end of the rainbow.
Okay, good. Now I'm going to have you read that 2 more times so that we can make sure that all the measurements that I get are the most valid and reliable possible, okay?
Okay.
Okay, Mr. Doe, the next thing that we're going to do is going to allow me...
Hold on.
You alright?
I have something stuck in my throat.
Oh, here. Why don't you take some water instead? Better?
Thank you, darling.
No problem. Okay, so the next thing that we're going to do is going to allow me to see how high and how low you can make your pitch, okay?
Okay.
So we're gonna do this by you using two words, whoop and boom. And on the word whoop, you're gonna start off low and go all the way as high as you can. And then you're gonna start to say boom as high as you can and go all the way down. So I'm gonna demonstrate this for you. I'm gonna take a nice deep breath before I start. And watch me. Okay, you see how I kind of made a mountain-like shape there? I went all the way up, and then I came all the way down. And I went really slow, so when I was coming down, it almost sounded like a siren turning off, right? Because I went so slow. So I want you to try that now. And take a nice deep breath from your belly. Oh, no, that's from your chest. Let's take a good one from your belly right there. Yep. And whenever you're ready.
What's the word again?
Oh.
Sorry.
That's okay. We're going to do it on whoop and boom.
Okay.
Ready? Good. I can tell you worked really hard there and you made your sounds last a long time. I really liked how you did that. The next task I'm going to have you do is to hold out the ah sound. So like this. Ah. And I want you to do that until this whole box fills up with green. It's going to be about 3 or 4 seconds, okay? So I'll show you. I'll do it first. I'm going to sit up nice and straight. Take a big, nice breath in from my belly. Go. Ah. You see how I filled the whole box?
Yeah.
Do you think you can do that?
Sure can.
All right. So let's sit up. Nice deep breath from our belly, and whenever you're ready.
Ah.
Good. Okay, so we're going to do that 2 more times, okay? Okay, the next thing I'm going to have you do is hold out the S sound for as long as you can. Oh, do you need another drink of water?
No.
You sure? That might help your feeling in your throat and you're wanting to clear.
Okay.
Good. Okay, so I want you to try and hold out the S sound as long as possible, like me. Ready? Go. Good. Okay, now we're going to do the exact same thing 2 more times, okay? Okay, good. So now we're going to do it with the Z sound. So I want you to do the same thing. Hold it out as long as you can, as steady as you can with the Z like this. Okay?
Mm-hmm.
Whenever you're ready. Good. We're going to do that 2 more times.
Okay.
Okay, you did a great job with that. The last thing I'm going to have you do today is hold out the ah sound for as long and as steady as you can, all right?
Okay.
So whenever you're ready, go ahead.
Ah.
Good. We're going to do that 2 more times, and then we'll be all finished.
I'm tired.
I know, it's a lot, isn't it?
It is.
Okay, Mr. Doe, you did a really great job in here. I really appreciate how hard you worked. We're going to go back to the other room now, okay?
Okay.
Thank you.
Okay, Mr. Doe, so the last thing we're going to do today before you leave is just try a few things out and see what works and what doesn't. So if and when you do come back for therapy, we'll kind of know where to pick up, okay?
Okay.
So the first thing we're going to do is a breathing exercise. So I first want you to watch me, and I want you to tell me what you see, okay?
Okay. I don't see anything.
Here, let me try using this band. It might be easier to visualize.
Oh, actually, moving down there.
Exactly. So, what is important for voice and have the air coming from down below to power your voice, okay? So, now that you've seen me take a breath in, I would like you to take a breath in.
Okay.
So, how did that feel? Or where did you feel that you were breathing?
Around here, actually.
Right, exactly. So, believe it or not, many people breathe here an incorrect way of breathing, because what it does is it causes a lot of tension to your vocal cords because you're breathing in this area when you should be breathing from down here at this nice big muscle known as the diaphragm.
Oh,
So you should really be breathing through basically your stomach
okay.
to power your voice for appropriate voice production, okay?
Okay.
So that's probably where a lot of the tightness is coming from. So now I want you to take a deep breath in, but I want you to sit up straight, and I want you to try to really breathe from down here at your diaphragm.
Down here?
Down there.
Okay.
How did that feel?
Normal. Good.
Normal?
Yeah.
So I still noticed a little bit of elevation in your shoulders.
Okay.
So what I want you to do to help you is, it's going to be kind of difficult sitting down, so if you could stand up for me really quick.
Oh, okay.
And I'm going to wrap this around you so you don't have to worry about holding on to it.
Okay.
So I want you to breathe again from your diaphragm, but make sure to look down so you can see the green band moving, okay?
Okay. From where again?
From this muscle right here, the diaphragm, okay?
Okay.
And how did that feel?
Felt kind of weird.
It felt kind of weird.
Yeah.
And it's going to feel weird for a little bit because you can sit back down.
Okay.
It's going to feel weird for a little bit because you're so used to breathing up here.
Yeah.
And that's why it's important to practice this exercise and really breathe from down below. And after more and more practice, it'll become more natural for you. But I completely understand why right now it might feel unnatural.
Okay.
Okay, perfect. So the next thing we're going to do, Mr. Doe, is go over something known as vocal function exercises. And what it really is considered like physical therapy for your voice cords.
Oh, okay.
Okay. Strengthen and properly move the muscles used for speech. And it creates a balance between the three systems used for appropriate vocal production, okay?
Yeah.
So we already discussed the first one, which is from down here. So breathing, the respiration.
Yeah.
So that powers the voice up here at the vocal cords for phonation.
Yeah.
And then resonance is when we bring the sound all the way to the front, okay? And so all three of those are what creates the most optimal voice, okay? So, with that said, since we already went over breathing, you should be a pro now, right?
From down here.
From down here.
Yeah.
So I want you to remember when we're doing these exercises to sit up straight,
Okay.
breathe from down here, and I want you to really focus on bringing that sound forward. And really remember to round those lips. They're almost like shaking. That's how much I want you to round those lips, okay? Can I see you round your lips? Good. So what we're going to start off with is we're going to sustain the E sound. And I'm going to go first. I'm going to play a tone on my virtual piano right here. And you're going to sustain the E sound for as long as you possibly can, but in a comfortable tone. And your voice should be soft, and try to avoid being breathy and no pitch break. So that's what we're going to do first. So I'll go first and then you'll go after me, okay?
Okay.
Okay, ready? Now your turn. Now how did that feel?
Normal.
Normal?
Yeah.
Okay, so I really want you to remember to round those lips.
Oh yeah, I forgot.
Bring the sound forward. You did a great job of standing up straight and breathing from your diaphragm. But I really want you to remember to round those lips, okay? And bring that sound to the front. One more time, ready? And how did that feel?
That was better.
Good, good. I could tell.
Yeah, like smoother a little.
Exactly, good. So we're going to move on now, and we are going to use the word knoll.
Okay.
And what you're going to do is you're going to go from low to high. So imagine like you're going on an elevator from the first floor all the way to the top. And if you have a pitch break like we discussed earlier, I want you just to ignore it.
Okay.
So it's like you're skipping every single floor and you're going straight to the top, okay?
Okay.
So I'll go first to show you what it's like, okay?
Okay.
Okay, just like that.
Okay. No.
How did you think that felt?
It didn't sound very good.
Okay, how did it feel?
Kind of hurt here.
It hurt?
Yeah.
Okay.
I don't like doing this. I can't go from low to high.
Okay. Okay, well, why don't we just go on to the next one then if you don't feel comfortable with that one, okay?
Thanks.
Okay. So next thing we're going to do is use the same word, but we're going to go from high to low, okay? So I'll go first again. Okay? So think of it like a skydiver going from the top of the plane all the way to the ground.
Okay.
Okay? Whenever you're ready.
No.
How'd that feel?
Okay.
Good. I think so too. So we're going to go on to the next exercise. And what we're going to do is use the piano to help you match pitch.
Okay.
So I'm going to play a note, and then you're going to say this, you're going to make the sound with the word old, but instead of old, you're going to take away the D, so it's old, okay? And we're going to do it with a few different notes on the piano, okay? Okay. So I'll go first, and again, diaphragm, sit up straight, round those lips, okay? So here's the first one. Ooh. And I should have said this, I'm sorry. You're going to sustain the note as long as you possibly can. And again, avoid pitch breaks, okay?
Okay.
Alright, your turn. Stand up straight.
Oh yeah.
Good. Ready? Good. Now we're going to do the next one. Ready? Oh. Now it's your turn.
Okay.
How'd that feel?
I thought it got better at the end there.
Yeah. Okay. Good. Remember to keep that posture, okay? Make sure you're sitting up straight, okay?
Okay.
Alright, next one. Oh. How'd that feel?
Better.
Good, good. Alright, next one. Oh. How'd that feel?
Well, it was kind of bad at the beginning, but then it got better.
Good. Alright, so let's go on to the next one, okay? Last
Okay.
one. Oh. And how'd that feel?
Pretty good.
Good. I really like how you brought that sound forward. And look, you went from low to high. You just didn't even
did?
realize it.
Really?
Yeah.
Oh.
Good job. Great. Do you have any questions before we move on?
No.
Okay. Okay, Mr. Doe. So the last thing we're going to go over before you get out of here is vocal health and hygiene.
Okay.
So I know you had said in your case history, and we talked about it briefly in our interview, about you being diagnosed with gastroesophageal reflux.
Oh, the GERD. Yeah, that's the worst.
Yeah, it is a headache. So when we were looking at your vocal cords, we noticed that you showed some signs suggestive of laryngoesophageal reflux. So what happens with laryngoesophageal reflux is the acid is actually coming up past your esophagus and emptying into your larynx.
All the way up here?
All the way up there.
Oh.
I know. A lot of people don't know they have it, and a lot of people aren't aware because they don't show the typical like heartburn signs that you might feel. But it does occur, and like the redness and irritation and the pachydermia all show the chance that you might have it.
Oh.
So I'm sure when you met with your gastroenterologist, he had given you an overview of, foods to stay away from and other reflux management techniques. So you said that you still really love, that spicy food.
Oh yeah, I can't stop eating that. That's my favorite.
And I know it's really difficult to kind of take away from the things you love, but they really do impact your voice just as much as they do your esophagus.
I take the medicine for that.
And again, it might be helping with that heartburn like we had discussed earlier, but there's a chance that those spicy foods and that chocolate that you still love and that tea, all of that can still be contributing to the acid and affecting your voice. So it's really important for you to really try to shy away from those. I know it's hard, but you really need to start decreasing that intake because that acid's horrible for your vocal quality.
I'll try, I guess.
Okay, good. Well, at least you'll try. I'm going to give you this handout which outlines all the foods that you should eat, the food that you should, stay away from, that's going to kind of help you, okay?
Okay.
And another thing in terms of reflux management is the way you sleep. So I know you had said that you sleep on a really flat pillow.
Yeah.
Now, and I know you had also said complaints that when you wake up in the morning, your voice is worse. So what is probably happening is that acid is just hanging out in your larynx at night. And nothing should be in your larynx except for oxygen. There should be nothing. And that acid is just sitting there, and that also is impacting your vocal quality and damaging your vocal cords. So what I usually tell my patients is to either get a firmer pillow or just stack some books under your mattress so it elevates.
Oh, okay. I could do that. I
Yeah.
do that when I'm sick.
Okay, perfect. It's going to make tremendous difference in your voice, especially now when you wake up in the morning and you don't have a voice, and it's really going to help.
Yeah, I'll try that.
Okay. So I give you this sheet. Take home with you.
Thanks.
And then I also, before we leave, want to talk about hydration.
Okay.
We had discussed how much water intake you have a day, and unfortunately that's not enough. We need to increase it a little bit more.
Really?
So what you're supposed to be having is 48 ounces a day,
Okay.
which is equivalent to 6 cups of water.
Oh, okay. Yeah, I probably don't have that much.
So what I usually tell my patients to do that really struggle with higher water intake is to get a container that fills that 48 ounces
Okay.
and just make tallies on it with times throughout the day. And so like you're racing against yourself. So you have to drink a certain amount of water by that time. So by this tally mark, by 3:30 this tally mark should be hit.
Oh,
And so you'll be like competing against your lines to get that water intake in.
Yeah.
So it makes it a little bit more fun.
Yeah.
Because what happens when your vocal cords don't stay hydrated is your body produces this thick and sticky mucus that covers your vocal cords, and it makes it difficult for the vocal cords to vibrate. And that's why sometimes you feel that sensation in your throat, like you have that sinus drainage that constantly has you
Yeah.
clearing your throat.
Oh, yeah.
So that's is contributing to your constant throat clearing because you feel like something's stuck because of that mucus. And with that said, also in terms of hydration is you had said in your case history that you feel that the Mucinex helps your vocal cords or your throat.
Yeah, that does. I take it once a week when it gets really bad.
Right, and I'm not sure which type of Mucinex you're taking, but some contain antihistamines in it,
Yeah.
and antihistamines actually dry out the throat more, or the vocal cords more, and that could be also contributing to your dryness, which also contributes to more mucus production, which contributes to more throat clearing. So you might think it's helping, but it may not be, so you might want to kind of watch how often you take that Mucinex.
Alright.
Yeah.
I guess I'll try and stick to the water maybe.
So then the throat clearing, which is this whole cycle with the hydration, and so with the throat clearing, when you clear your throat, what's happening is you're actually causing them to slam together and rub together.
Oh, really?
So when you do that, they become more irritated and more inflamed. And when that happens, you produce more mucus. And producing more mucus, because your body's trying to fight it, actually causes you to clear your throat even more, because you have mucus in your vocal cords. So then it's this whole cycle. So
it doesn't help because it feels like it helps.
and a lot of people feel that way, but what you should really do to help is every time you feel like you need to clear your throat, just drink some water. Just take a sip, which will
Does that work?
It helps, yeah.
I can
And
try that.
and that will help you with your 48 ounces of water intake a day.
Yeah.
So with all that, that's all I have for vocal health and hygiene. And basically everything else we've gone over that we need to. Before we leave, do you have any other questions for me?
I don't have any questions now.
No? Okay. Well, I'm going to give you this paper as well.
Okay.
I want you to take those home and go over them. Well, it was very nice meeting you, Mr. Doe.
Thanks, you too.
Bye-bye.
Bye.